I'm a little under the weather, so you have to forgive me.
First and foremost, thank you for your time, and that's totally fine. I realize that the shall intake process and evaluations are lengthy. There's a lot of paperwork to fill out, so thank you very much for your time here.
Yeah.
Part of doing your treatment plan and your counseling sessions is finding out as much information as we can. So there's going to be a series of assessments that we're going to go through together today, okay?
Okay.
The first one is called the Audit Assessment. It stands for the Alcohol Use Disorder Identification Test. You did say that you like to drink, so we're going to go through a series of 10 questions.
Drinking's fun.
The first question, how often do you have drinks containing alcohol? Is that a daily thing?
Yeah. I mean, I live that party life.
Sure. How many drinks containing alcohol do you have on a typical day when you're drinking?
Quite. I'd say a few. 5, 6.
Okay. Gotcha. How often do you have 6 or more drinks in one session?
Most nights.
So you think that's a daily or weekly thing? Because you said you only had 5 or 6, so you think you do more than 6 on a weekly basis?
It'd be more weekly for that one, yeah. Friday, Saturday hits, we're all kind of feeling good.
Gotcha. So how often during the last year have you found that you are not able to stop drinking once you started?
Oh, if we're out to party, like we're going.
Gotcha.
So definitely
on a weekly basis, monthly basis,
daily. Weekly's pretty safe. Like I said, that Friday, Saturday vibe hits. We're just
awesome.
We're feeling it.
Okay. How often during the last year have you failed to do what you normally were expected to do because of drinking? Lost a job, argued with a friend, set out to do something that you weren't.
We get in arguments a little bit. It's been hard trying to hold down a job that understands my schedule above everybody else's.
How often during the last year have you needed a first drink in the morning to get yourself going? Like an eye-opener.
I usually start my days with a nice eye-opener.
So you think that's a daily thing?
Yeah.
Excellent. How often during the last year have you had a feeling of guilt or remorse because of drinking?
If I get into a big enough argument, I'll kind of feel bad about it. I go back and apologize.
A daily thing or a weekly
No,
thing?
definitely not a daily thing.
It's a weekly?
Few times a month, maybe.
Okay, so monthly.
Yeah.
Gotcha. Awesome. How often during the last year have you been unable to remember what happened the night before because of your drinking? Ever had blackouts?
I've had blackouts.
Okay. Weekly, monthly?
Monthly.
Okay.
Monthly celebrating month, the month.
Have you or someone else been injured as a result of your drinking?
I've never hurt anybody. Like I might take a spill, or I might have to sit down quickly, or than I thought.
You ever injure yourself when you do take a spill?
Yeah, there's a couple scabs here and there, or just a little torn skin or rug burn or something.
In the last year?
Oh yeah.
Has a relative, friend, or doctor or another health worker been concerned about your drinking?
Yeah, a lot of my friends or family will mention it to me that they want me to cut back a little bit.
So in the past year?
Oh yeah, easy.
So let me just tally this real fast. Give me 1 second. Okay, good job, thank you. All right, the next assessment we're going to do is going to be dealing with the opiates, because I know that in your assessment, your original assessment, you did say that you like to do opiates, heroin specifically. So we're going to ask just a couple questions regarding that. Are you having any withdrawal symptoms as a result of using opiates? Do you use them all the time, or is it a daily thing?
I use them a lot. I guess I want to avoid the withdrawal,
Okay. Right.
so try to.
So you use it to prevent withdrawal?
Yeah.
Okay.
How about the party?
Have you had a raised pulse rate in the past 24 hours?
Yeah, man. Sometimes you get a little bit of a rush going on. You want to keep that feeling going.
Okay. So sweating more than normal?
Yeah, it's hot outside, so you sweat, and sometimes the party kicks up a little bit.
Any restlessness?
Yeah, my legs get pretty restless at night.
Okay. Any bone or joint aches?
His shoulders hurt.
Okay. Runny nose, sweaty, or itchy eyes?
Yeah.
Upset stomach?
Not at the moment.
Having tremors where you shake?
If it's been a long time, I'll get them.
Okay. Feeling tired or yawning at all?
Not recently, no, but I'm kind of out of buzz with it.
Any sweaty palms or sweaty foreheads or sweaty armpits?
Yeah. I tend to sweat a lot through the hands there.
So the next one I want to talk about is the consequences of substance abuse. We'll just X out whatever you have. Have you felt the need to cut down your drinking?
If I felt the need,
Right.
no, I would not say I have felt the need.
You ever been annoyed by others criticizing your drinking? Ever felt annoyed by others criticizing your drinking?
Yeah, you know, and the family jumps at you, and like everyone's just riding your case about it. Yeah, it's definitely buzzkill, downer.
Ever felt guilty about drinking?
Yeah, only if it involves a friend.
Okay. And ever need a drink first thing in the morning? I know we asked that one, so yes, you have.
Yeah,
Increased tolerance if you're able to drink more over a long period of time.
yeah, I could drink a lot.
Withdrawal, shakes, sweating, nausea, heart rate.
Like I said, you know,
Seizures or blackouts.
no seizures at all. You black out a couple times.
Any effects on your physical health overall?
I got bad breath.
You ever consume more than you intended to take? Like I'm only going to have a couple drinks, and then you wind up drinking a case.
Usually, I jump, you know, right in the pool with it. So if I'm going to go drinking, I'm going to go drinking.
Gotcha. DUIs or arrests?
Quite a few.
Okay. Fights or assaults in the past, say, 6 months?
Maybe one little tiff.
Relationship conflicts?
Nah, no relationship.
Okay.
Hold me back.
Problems with money or loss of job?
You know, work gets hard to find every now and again, you know, but luckily they're understanding and will bring me back, but nothing consistent. You know.
Let's talk about your substance use history, okay? And I'm just going to go through some stuff that you may or may not have ever used. If you haven't used, no big deal. We'll just skip forward, okay?
Mm-hmm.
You've used amphetamines or speed?
No.
Barbiturates or downers?
No.
Like pills, like Xanax, like...
Xanax I'll use every now and again if someone brings it around. Yeah, I guess.
How often?
When they bring it around.
So once a month or
yeah,
once
maybe
a year?
pretty infrequently.
Okay, gotcha.
Every couple months, maybe.
Every 6 months? Gotcha. How do you do it? You just take it orally?
Yeah, that's the easy way to do it. Usually chase it down with a shot or two.
Opiates, heroin. I know that you said that you did that.
Yeah.
How old were you when you first used opiates?
Late teens.
And how long has it been since you last used?
Maybe a day.
Okay. You usually do it. You inject it. Do you do it orally? Do you snort it?
I usually do it orally because it's easier to do it in a crowded place without having to excuse yourself. But if I'm just hanging out outside the beach, yeah, I'll probably do an injector.
How much per day do you say you use?
I wouldn't say it's a daily thing. But
All right, so it's a couple days a month.
yeah.
Okay, got it. Cocaine?
No.
Okay. Psychedelics, LSD, ecstasy, bath salts?
No.
Okay. Inhalants, glue, aerosols?
No.
Okay. Marijuana?
Yes.
Okay. How old were you when you first used marijuana?
Early teens.
When was the last time you used?
This morning.
You usually smoke it?
Oh yeah. Just a quick, a couple drag on a drag.
How much per day do you think you use?
There's enough of it around. Probably do a couple joints a day and just kind of get through with feeling pretty mellow, feeling pretty grooved.
So 30 days this month, you usually pretty much every day?
Yeah.
Okay.
Pretty consistently.
Benzodiazepines?
No.
PCP?
No.
Okay. So now you do have some pain as a result of you quitting, and we did talk about that. Mm-hmm. So let's just go over the pain index. This next assessment will take care of that. Okay. What's your pain? So 0 being no pain, 10 being the worst pain you've ever had. What was your pain level on an average day in the past week?
Usually waking up pretty sore around, so probably say like a 6 or 5, 6, maybe 7 at the worst.
What was the pain level at the worst?
Probably an 8 or 9. Really, really rough to get going, but that's what those morning starters are for.
All right, so were you able to relieve your pain in the last week with what you...
Yeah. Oh, yeah. I know how to take care of myself. I got some friends to help out with that, too.
Gotcha. Excellent. Any effects on your physical functioning? Do you have locking joints? Do you have anything like that?
In the morning, it's hard to get moving.
Any family relationship problems as a result of your using?
I mean, they're not happy, like I said, with it.
Social relationships, friendships lost as a result.
I mean, some in the past, yeah.
Any mood swings, violent mood swings.
If you're in my way, yeah.
There we go. All right, sleep patterns affected, or
When I sleep hard.
how's your overall function?
Good. Just got to get past that morning hurdle.
Let's see. Any nausea, vomiting, constipation?
No.
Okay. Any itching, mental cloudiness, like foggy brain?
Yeah, sometimes it'll be a little hard to focus, but, we get through it.
It's pretty mild.
Yeah.
All right. Any sweating, serious sweating, mild, moderate?
No, none that I would say.
Okay. Fatigue, drowsiness?
Yeah, kind of get a little bored. Body feels a little bit tired. Just want to go for a nap.
All right, this next assessment will be about your overall mental stability. Okay, so any depression in the past little while, little interest in or pleasure in doing things.
There's been a couple of times you wake up depressed and you're just kind of, what's it about? What's the next adventure? What's the next trip?
Gotcha. Feeling down, depressed, or hopeless?
Not hopeless. No, hopeless. Strong.
Okay. All right. Trouble falling asleep or staying asleep?
Yeah, that's what those drinks are helping us for.
Poor appetite or overeating?
Overeating, yeah. Yeah, you get in the party and everyone's around you and you're doing a bunch of stuff. So, yeah.
Okay. Feeling bad about yourself, that you're a failure, or that you've let yourself down?
No, not at all.
Okay. Trouble
I haven't let myself down at all.
Gotcha. Trouble concentrating on things such as reading the newspaper or watching television?
I don't know. Yeah, I don't read the paper that much, so I don't really have the energy to want to sit in front of the TV too long.
Moving or speaking slowly so that other people could have noticed?
If I get jazzed,
Or you're fidgety?
Yeah,
Fidgety?
real. Can't sit still, can't
How often
stop
does
moving.
that happen?
A lot, just don't like to be too still for too long.
Thoughts that you'd be better off dead or hurting yourself in some way?
No,
Suicidal thoughts?
Maybe fleeting.
Okay.
Very few and far between.
All right, so very rarely.
In the past.
Excellent. Well, that concludes our assessment process. I appreciate your time. Thank you very much for making time for me today.
Yeah, of course.